Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome Morgan Hardy. He's a psychiatrist. Today's Kevin MD article is a surge in adult ADHD diagnoses helping or harming patients? Morgan, welcome to the show.
Thank you. Thanks for having me on.
So let's start by briefly sharing your story and journey.
Yeah, absolutely. So I am a psychiatrist with the U.S. Air Force. I'm currently based out here in the U.K. And I should note that everything I share on here is not the official policy of the U.S. Air Force or the Department of Defense, my own opinion. But I've been out here for about 3 years, graduated residency in Texas in 2021, and then came out to the UK after that.
All right. So you are working, of course, in the Air Force. So from that standpoint, what are some of the typical things that you're seeing? What are some of the typical diagnoses and cases that you see regularly?
Absolutely. So working in the military, I'm working primarily with a young population. 18 to 30 is my average demographic. And these are individuals across a broad swath of the American public. And so I see a lot of the same conditions that you would see in young adults: depression, anxiety, and definitely an increase in the number of adult ADHD cases that we see. In addition, we see a fair amount of PTSD, which I think is common in the military patient population.
All right, and let's talk about one of those conditions in your article. Is the surge of adult ADHD diagnoses helping or harming patients? Now, for those who didn't get a chance to read that article, tell us what it's about.
Yeah, so I was very interested in this topic of this recent increase that we're seeing in adult ADHD diagnoses. There was a recent CDC article that was published that showed that 1 in 16 Americans have been diagnosed with ADHD. That's 15.5 million Americans. And this has been a trend that's been increasing over the past 10 to 15 years. And I myself was seeing a lot of these patients coming through the clinic, and I became very interested in this trend. Is this something that is good? Is it bad? What does this really mean for us? And so my article discusses this. And what's really interesting, Kevin, is that when you look at the data, it's very nuanced, and there's actually very robust clinical data that suggests that treatment of ADHD is a good thing. It decreases all-cause mortality. It decreases rates of substance misuse among people with ADHD. And so it seems like this is a very, very good trend that we should be increasing our diagnosis and treatment of ADHD. But there's also some potential harms that we have to recognize. And there's evidence to suggest that it increases risks of cardiomyopathy in young people. It increases blood pressure, heart rate, also increases the risk for psychosis. And so these are not, treatment of ADHD is not, it's not always benign. And so we have to look at this very nuanced picture that yes, there are people that are being helped, but there's also some potential harms that come along with that.
So when you look at the root causes that account for the increase in those numbers, what do you think is the cause? Is it simply improved awareness? Is it social media? Is it the fact that our society in general is more distractible? Do you have any hypotheses in terms of why those numbers are rising?
Yeah, I think it's a very mixed picture. I think on one hand, there is increased recognition of ADHD as a diagnosis. We used to think that ADHD was a condition you just saw in children, that it largely went away when you were an adult. And what we've now found is that at least 50 to 75% of people who have ADHD as a child continue to have it as an adult. And so a lot of my patients that I'm seeing either were treated as kids and then stopped treatment prior to the military, thought they were fine, joined and are continuing to have problems, or they were never diagnosed as children, but they like was very clear they had lots of problems, and just they never got recognized. So yes, there definitely is this trend toward increased diagnosis, which I think is very appropriate. On the other side of the coin, I think, as you allude to, there is a lot more people coming in with concentration and attention issues that I think are largely socially driven. And so, there's good evidence out there that social media, technology definitely increased the rates of people's distractibility. But also, I think the modern work environment, we definitely saw this with COVID, where suddenly everyone's working from home a lot more. They're on their computers. This kind of blending of work and personal life is happening a lot more, where people don't have a kind of clear 9 to 5 job. It sort of all blends together. You could be responding to emails or text messages about work throughout your day. And so I think that also contributes to this increased distractibility that people feel, which may look very much like ADHD. I think another problem that doesn't get talked about enough is that probably most of us don't sleep enough. I ask my patients how much sleep they're getting. They're routinely telling me 5 to 6 hours of sleep, which is definitely not enough. We should be getting 7 to 8 at least. And so I think, we're all more sleep deprived. We're all more connected to technology, and we have less boundaries with kind of work and personal life, which really turns into a lot of these attention concentration symptoms that I think can be misdiagnosed as ADHD.
Now, in a military setting, how do patients typically present to you that may be suggestive of ADHD?
I think when patients are coming in with a kind of history of really struggling in their job, so they're assigned to some specific position that they're supposed to fulfill, and they're just getting written up a lot by their supervisors. They're really struggling to adapt to the fast-paced military environment, and they're basically, sometimes they come in where they're basically at a point of they're going to get kicked out of the military unless they get some help. And when we really dive into what's been going on, it's clear that they have all this distractibility, and and then I diagnose them with ADHD, and we start treating it, and they can often do quite well. And so I'm always really looking at the dysfunction, and that's often more important than just the symptoms that people describe.
So tell me about your decision-making process if someone presents you with these symptoms of distractibility and maybe suggestive of ADHD, and the questions that you ask the patient, the questions that you ask yourself to determine what is the right treatment path for them.
Yeah, so it's always a question of, as I said, how much dysfunction they're experiencing, and is it appropriate to move forward with pharmacotherapy? I think it's always important that we don't only look at pharmacotherapy as the solution for people with ADHD. Because yes, I think the stimulant medications can be enormously helpful, as I've mentioned, but I think there's a lot of lifestyle changes that need to be made. And so I always address sleep with my patients. I always ask, as I said, ask them about their sleep, really try to help them improve their sleep. We look at their use of technology and whether that's really interfering with their attention and concentration. We look at how they're structuring their work and whether there are changes they could make in their kind of patterns of work habits, and that can be enormously helpful as well. And then after all those things, if they're still really struggling, yes, let's talk about like appropriate medication to help you.
Can you give us a couple of case studies where a patient improved with pharmacotherapy, but also you mentioned some of the risks of pharmacotherapy. So sometimes I feel that's not often highlighted. So tell us also a case where pharmacotherapy for ADHD like symptoms was a detriment to the patient. So give us two case studies of a success story and a story of failure with pharmacotherapy.
Yeah. I think one case that comes to mind was a young man who was referred by his leadership because he was just really struggling. He wasn't showing up to work on time. He was making mistakes. He was getting written up. He was getting, disciplinary action against him, and didn't really. It was never really on his radar that he had ADHD. He just thought that was the way he is. So I started interviewing him. I gave him some questionnaires to complete to ask more about symptoms. And it really became clear that he had this lifelong problem with executive function and attention, concentration, impulsivity. And so we were able to start treatment with him, and things turned around and he did a lot better and he was much more successful in his job. So I think that's, and I've had several of those types of cases that are really success stories in treatment that can really make a huge difference in people's success in life. Another case that really highlighted for me the importance of caution was that I had a patient. I actually hadn't diagnosed him with ADHD. It was a primary care doctor who saw him about 6 months before I saw him, had diagnosed him with ADHD and started Adderall. And he, come to find out, had a lot more issues than just ADHD. He had a really severe history of trauma, had post-traumatic stress disorder, which I think was probably causing most of his perceived attention problems. And he started abusing the Adderall. He started, instead of taking it throughout the week, he would save it up for the weekend and kind of take it all at once and have, this euphoric trip with his Adderall. And then this became more and more problematic and presented the emergency room with full-blown psychosis. He was paranoid, he was agitated, and it became clear this was all from his Adderall. So we had to take him off of that. We had to enroll him in a substance use treatment program and really help him recover from that. And so I think that's just an illustration of how we have to be really cautious about, first of all, making the right diagnosis, and then really educating our patients about some of the risks associated with these medications.
So knowing that some of these pharmacotherapy options for ADHD can be habit forming, do you see any parallels with the increased frequency of prescribing in general with the opioid epidemic going forward?
I'm glad you asked that question, because I think that is something that we need to consider as we look at these trends. I think there are some important differences between this and the opioid epidemic, which I'll point out. But yes, absolutely. I think the opioid epidemic is interesting to look at, because similarly, at the time that the long-acting opioids were being rolled out and marketed to physicians, there was this idea that, no, these are very safe. These can be life-changing for patients. All of these patients with chronic pain who have been struggling for years. And this is a very good trend that we should embrace. And then obviously it all went, quite downhill from there. And then we've had all these problems. So I don't know, if the same thing will happen with this massive surge in stimulant prescribing. Are we going to see a trend toward increased abuse of stimulants generally? I do know there are increased rates of methamphetamine abuse, and overdose deaths from methamphetamines are on the rise. Does that correlate? I think it's a little early to say, but I think so absolutely. I think that's something we need to be cautious of. I also think there are some interesting differences, though. First of all, opioids there's never been any evidence that long-term use of opioids had positive impacts for patients. It's always been negative. Whereas I think there is good evidence that long-term use of stimulants for the right types of patients can actually have very positive effects for people. So I think there are some important differences, but yes, absolutely, I think we need to be very cautious about this trend.
We're talking to Morgan Hardy. He's a psychiatrist. Today's Kevin MD article is the surge of adult ADHD diagnoses helping or harming patients? Morgan, as always, will end with some take-home messages that you want to leave with the Kevin MD audience.
I think the most important take-home message I would leave for all of the clinicians out there is that don't be afraid to diagnose and treat ADHD in adults. I think that's an important message, but I also think we need to be much more discerning and cautious about our diagnosis and treatment, and much more aware of both the benefits and the risks of appropriate treatment.
Morgan, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you.